Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
It's Health Talk brought to you by Mon General on WAJR. And today we have as our guest registered and licensed occupational therapist Erin Double. And I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, Jim. Good morning, Erin.
Hi, Erin.
Hello.
All right. Now, today it's a new topic, and we're going to learn a lot more about it. It's lymphedema. You're a lymphedema therapist.
I am.
So for our listeners and everyone around the world who has no idea what the definition of lymphedema is, I'm sure that's part of your daily practice in that you have to tell people exactly what it is. So what is it?
Well, it's easier to explain with pictures, but lymphedema is an abnormal accumulation of protein-rich fluid in a body part. So it can be found either in your arms or legs, your genitals, your face, your neck, but it's most often located in your arm or leg.
An accumulation of protein-rich blood. Fluid. Okay, how does it get developed? Where does it come from?
You develop lymphedema, it can be either primary or secondary. So you can be born with a abnormality in the lymph system, and it can just develop without any warning, or you can get it from having like a cancer, trauma, radiation, infection, and it can develop after that where there's been an interruption in the lymphatic system.
Explain to us the lymphatic system. What does it do?
The lymphatic system is comprised of cells, organs, tissues, and the lymphatic system, its main job is to clean the body with proteins. And with lymphedema, you have cells in your body, and the cells attract the protein from. Let me start over.
So the lymphatics. I'm trying to help you here. The lymphatic system deals with proteins in the blood, and does it filter certain proteins out, or is it supposed to clean some of the proteins out? And when we have lymphedema, it's not taking enough proteins out.
Correct.
All right.
Very well done, Jim.
Thank you, Kay.
Give it your doctor.
Next question is yours, Miss Murray.
Well, it's something new to me. I haven't heard of this. So I guess one question I would have, do very many people develop this problem?
About 1% of the American
So it's not that many.
Not that many.
And have you been able to pinpoint why it happens? I know what Jim just explained, but you're saying we're born with this? Is this a chronic problem? Are we going to continue to have this problem throughout our life?
As of right now, yes, some people are born with it, not very many. Most people get lymphedema from having a cancer, such as the number one cause in the United States is breast cancer. But worldwide is filariasis, which is getting bitten by an infected mosquito.
This is one area, Jim, that I'm not feeling that it's our diet.
No.
Or exercise.
No. So
this is something we as individuals, if we go through cancer, we can't control, which is something that's going to develop in our body.
Correct. If you have cancer where your body undergoes chemo or radiation and your lymphatic system is affected, sometimes the body will recover and sometimes it won't. But you have lymph nodes in your body that do not regenerate themselves. Mm-hmm. And so if they remove enough lymph nodes and the body can't get rid of the proteins, then you can develop lymphedema.
Now, we had a visual of this. You did bring in some pictures today. So we kind of cover so many bases of the body on this show. Sometimes we don't realize we have a problem. Other times we do. With this, you're going to know it.
Yes.
The picture we saw looked like a lower leg was the most grossest swelling you could imagine without the skin bursting.
Right.
Yeah.
Really?
Yeah.
But it seems to be in pockets.
It can. Everybody's seen somebody with lymphedema. It's the big elephantitis with a large leg or arm. Usually most people see it in the legs. And then, but that's the most severe case. So you can have lymphedema in various stages. It can be latent or where you don't have any swelling, and then it can progress to where your arm or leg starts to swell. But if you raise it up, the swelling will go away. Then it progresses to where it's still swollen, but even if you raise it, the swelling won't go away. Then it starts to become more swollen and hard and crusty. And then at the last stage, it becomes severely large, and
You're going to know it.
and you're going to know it. You won't be able to fit in your clothes, and your skin is very hard, and then the blood's unable to pass through the skin or through the tissues underneath because the skin is so hard it's compressing down, and you have to worry about getting a blood clot.
I have heard of elephantitis.
Yes.
Is that what this is?
The most severe form of lymphedema.
I've heard of elephantitis in the genital area. It just sounds like the worst thing that could happen. How many people are affected?
Approximately 1% of the American population, or 2.5 million Americans.
So if we have 80,000 people in Monongalia County, 1% of 80,000 is 80? I don't know. But does that sound about right? And again, we'll probably need the guy to email us again with the math figures that we seem to have so much trouble here with. So 1%, and as Kay mentioned, when you have it, you know it. We're going to be talking about treatment. Any other warning signs before the swelling occurs?
Yeah, when you have lymphedema, you're generally going to have a heaviness or a fullness sensation in one side of your body, like an arm or a leg. You're going to have some tightness. You usually do not have any pain with lymphedema. The swelling usually starts in the hand or the foot, and then it can progress slowly or quickly up the arm or the leg.
You say it doesn't have pain, but I would think if you have a growth like that or a swelling like that, walking or lifting is certainly going to be a problem.
Right. It's very heavy and cumbersome for that patient to move, but it's generally not painful.
It looks painful, doesn't it, Jim?
It sure does. And so we're going to be coming up after the break talking about, again, what does lymphedema look like? How do you treat it? If you know anybody that had this, and sometimes it's called elephantitis, pick up the phone and give us a call. Let us know how they did. 304-296-0041. We'll be back to Health Talk on WAJR right after this.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Well, when you hear that 1% of the American population has lymphedema, you think, well, that's not that many. But, you know, when you have about 300 million Americans, that's a lot of people. And you have 80,000 people in Monongalia County, that's 800 people. That's a lot of people.
It's a lot of people, but we have a therapist now that she's going to fix it.
Yeah, that's right. Erin Double joins us this morning on Health Talk, brought to you by Mon General Hospital. So we touched on the 4 stages of lymphedema. If we come and get a diagnosis in that first stage, can we stop it from getting to the other 3 stages?
You can. Lymphedema is a chronic condition, so you're always going to have lymphedema, but you can try to prevent it from getting worse.
Oral medication, shots, how do you go about treating it?
You go about treating it with something called complete decongestive therapy. So it starts with, if you're diagnosed by your doctor, and your doctor clears you for having the treatment, you start with what's called a manual lymph drainage, or like a little special massage. And so myself or another certified therapist would come in, and they start and clear your lymph nodes in your neck, your armpits, and your groin, and then we work the fluid from your arm or your leg back to your heart, and it gets flushed out through your kidneys.
And in that first stage, or if I come to see you, are you just simply drawing blood and testing it for the amount of protein in the blood?
We are not. You are actually diagnosed from your doctor with a thorough history and examination. So the doctor is going to look for a lot of swelling or a little bit of swelling in your arm or leg and ask a lot of questions. Have you had cancer? Have you had chemotherapy? Did you have any compression to your arm or leg? And so it's usually diagnosed with just a thorough history and physical.
So you're always going to have it. The doctor will try to manipulate the fluid out or move it to another part of your body, drain it. What did you say there?
Yeah, I do that.
You do that?
I do that. I start by...
That's something you always dreamed of when you were growing up as a child? I want to do that and help people.
No, but it's very effective.
Okay, so explain to me what you do.
So you start by clearing out the lymph nodes in the neck, the armpit, and the groin. So let's say if you have breast cancer and you have swelling of your arm. What you want to do is the lymph nodes in the left side of your arm, if you have left lymphedema, are going to be clogged. So you want to move that fluid from the left to the right.
Is that by massaging?
Right, or down to your left groin.
So you're trying to relocate it in a sense to a point where it'll flush out?
Exactly. Exactly. So we just take small little circles with our hands and massage the fluid up out of the arms and across the chest or down the side of the body.
Is it going to want to go back to where it came from?
It is. And so after you massage it, then you're going to bandage it with a special multi-layer bandage. And we put a lot of compression in the hand and then lessen the compression as you go up towards the shoulder.
So there's no cutting or surgery or no penetrations of the skin at all.
Or could there be?
You're massaging.
Right. You're massaging and then you're bandaging to keep the fluid from coming out. And after you're done with treatment, then you get put into a compression garment that you'll wear 24 hours a day, take off for bathing for the rest of your life.
We've talked about compression stockings or leggings for those with varicose veins on a previous show, but you have compression garments that will hold tight to your skin and keep the swelling down?
Correct. They're similar to the ones that you do for the legs, but you can also make them custom for your arm or leg. And what it does is it pushes down against the skin, and so when you move, it'll push the skin, and underneath the skin is where the lymph node lies, and so it helps to activate that muscle pump to push the fluid up out of the arm and keep it contained.
Is that restricting, and do you have to wear the compression garment for the rest of your life?
You do.
Is it restricting in any way? Does it keep people from doing what they want to do?
No, it's just a sleeve, like you would wear a pair of socks or.
Yeah. In the arm, though, but I mean, if you have lymphedema in other parts of the body, are you wearing compression type garments there as well?
You are. You can get like compression bras. You can get compression biker shorts, pantyhose, socks. It all depends on how severe your lymphedema is. You may just need a hand piece or an arm piece, leg piece.
Why is it for life? I don't understand. Once you work it out and it's gone, why is it for life?
It's a disease. It's not where, if you just have edema, that's swelling, and it's due to a condition. And so if you just have swelling and your condition, if the doctor treats your condition, it'll go away. But with lymphedema, it's a disease. And
your lymphatic system is diseased?
But there's
or
medicine
damaged.
out there all the time for diseases and pills we can take. Nothing has been developed to prevent this disease, make it go away.
Right. As of now, no. Sometimes people think, why can't I take a diuretic or a fluid pill? And a diuretic actually takes the water out of your system, but it leaves the protein. When you have lymphedema, you have an increased concentration of protein in the system, and the protein attracts the water. So increased protein equals increased water equals increased swelling.
Because when I hear protein, I think, well, then just stop eating meat,
Right.
or stop doing this or that. That really doesn't have a darn thing to do with it.
No, you always have protein in your body. And with the lymphedema, the lymph system cannot get the protein out.
How often have you seen people say, well, I'm not going to live with compression bandages the rest of my life, and you work the system and you get them free of this, they still have the disease. How soon would it take it to come back and develop again?
It depends on what stage they're in. Some people, if they're in the stage 1 where it just swells and goes back, then pretty easily. I mean, maybe they just wear compression during the day and they do nothing at night, or they don't wear any compression at all. It's when the lymphedema gets worse, and people actually love the compression because it makes them feel better. They can move, they can wear a jacket or a pair of pants or shoes to walk in, so they really enjoy the compression because they don't feel not contained.
But some people need the compression 24/7?
Some people do, and especially the worst thing with lymphedema is getting an infection. And if you get an infection, that can make the lymphedema worse, and it becomes this vicious cycle. So
a skin infection we're talking about. I mean, under I'm not sure how can you get an infection if you have a bee sting or something, or a cut of any kind, or it itches under there and you scratch it too much.
Right. Any nick, by any break in the skin, you can get an infection. And with a person with lymphedema, that infection can turn deadly quickly. So the person needs to go to the hospital right away.
After the swelling and you have it worked out of our body, what happens to our skin after that? Are we going to be able to, younger people just going to go back to normal, or will our skin ever be normal again?
If you have the later stages, the skin's elasticity should go back to being normal. If you have the elephantitis and you have a lot of skin folds and your arm or leg gets reduced, then you may need surgery to decrease the skin folds, because that is a breeding ground for infection.
Just like if you've been obese and you've lost 100 or 150 pounds, you would have to go in and have that taken care of too.
Correct.
I see that, if you want more information on lymphedema, you can call Mon General's Wound Healing Center. Is that where you work?
Yes, I work at Mon General as well as the Wound Healing Center.
I was going to say, I mean, the Wound Healing Center, I've been there before. They do great work there. So if you have lymphedema and you're being treated for it, then you'll be going probably to the Wound Healing Center to make sure it gets better.
Correct.
All right. If you have any questions about lymphedema, a very interesting topic this morning we haven't talked about before on Health Talk, pick up the phone and give us a call, 304-296-0041.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Got it.
Occupational therapist Erin Double is our guest today. She is registered, and yes, she's licensed as well. I mean, they even sent you on a special course to learn all about this. You said it was a difficult course?
It was. It's a very intense course. I went for 10 days. It was supposed to be for 10 hours a day. It ended up being a lot longer, and I did a 45-hour preparation before the course.
So you thought you'd be able to go and maybe have some fun, but they kept you in class all day.
Correct.
All right.
Let's just do a follow-up on this. Once it's been treated, one thing we want to rule out, though, it doesn't have anything to do with the diet.
No.
It doesn't have anything to do with the age.
No.
It has a lot to do with cancer, people that have had cancer. What about treatment afterwards? Okay, you've had all the physical therapy or the occupational therapy, and we're rid of the swelling. We have the compression bandages. What should we do then to try to help ourselves? Should we eat better? Should we exercise more?
After you've been through your treatment and your arm or leg is to the point it's going to be, you're going to want to follow the advice of your doctor and your therapist, but you're going to want to wear your compression garment to what they tell you, whether that's all day or 24 hours a day.
As always, follow doctor's orders.
Right.
Okay.
And you're going to want to watch your skin, which is very important. Again, we talked about not getting a splinter or a nick or burn or any kind of cut in your skin. You're going to want to watch for infection. And if you have an infection, you want to go to the emergency room right away. And then you're going to want to try to exercise with your bandages on, because it helps to stimulate that muscle pump, which is right underneath the skin, which will help keep the fluid
Do we
out of your
come
body.
back for more therapy throughout our life?
If your arm or leg would swell again, then yes, you would come back to therapy, and you would get treatment again, and maybe we try to get your arm or leg smaller and get you into a different garment. But it's sort of a lifelong condition, and you want to try to maintain it to the best of your ability.
You'll be glad to know that not only do we have a radio show about this topic today, but we're creating a video right now too, and I'm sure Tyler's getting the pictures together for the video package that will soon be on the website, mongeneral.com. So if you're curious to know what lymphedema looks like, and I know you are by now,
You'll be able to see it.
you'll be able to see it soon. Just go to mongeneral.com, and then down on the bottom right-hand side of the page, you'll see Health Talk Radio. Just click on that banner, and you can see today's show and also previous Health Talk programs at the website there. So, yeah, that's why it's all lit up in here, because we are on camera.
And do exercise afterwards.
Thank you so much for the information. And again, if you have any questions or suspect you have lymphedema, you can call the Mon General Wound Healing Center at 304-285-1460. That's 304-285-1460. This has been Health Talk, brought to you by Mon General Hospital on 1440 WHAR.